Welcome back to Senior Smart Money, where we help you navigate the complex world of retirement planning. I'm your financial advisor, and today we're tackling one of the most expensive and overlooked challenges facing early retirees, the healthcare gap between 55 and 65. If you're dreaming of retiring at 55, or you're already there, this video could save you tens of thousands of dollars in medical expenses. But here's what most financial advisors won't tell you about this critical decade. By the end of this video, you'll have a clear roadmap to protect both your health and your wealth during these vulnerable years. Let's start with a shocking reality check. The average American aged 55 to 64 spends over $6,000 annually on healthcare costs. But that's just the beginning. Without employer-sponsored health insurance, you could be looking at monthly premiums ranging from $800 to $2,000 for individual coverage, depending on your location and health status. That's potentially $24,000 per year just for premium payments before you even see a doctor. Here's why this matters more than ever. Healthcare inflation consistently outpaces general inflation by 2 to 3% annually. What costs $1,000 today in medical expenses will likely cost $1,300 in just 10 years. For early retirees, this creates a perfect storm of rising costs during a period when you're no longer earning regular income. But here's the good news. Smart early retirees are using strategies that most people don't know about. Let me share 5 proven methods that can dramatically reduce your healthcare costs during this critical decade. Strategy number 1, COBRA continuation coverage. If you're leaving an employer with group health insurance, COBRA allows you to maintain your existing coverage for up to 18 months. Yes, you'll pay the full premium plus a small administrative fee, but this is often significantly cheaper than individual marketplace plans. Here's the insider tip. COBRA premiums are based on group rates, which are typically 20 to 40% lower than individual market rates. Strategy number 2, health savings accounts or HSAs. If you have access to an HSA before retiring, maximize your contributions. The triple tax advantage makes HSAs incredibly powerful for healthcare expenses. Contributions are tax-deductible, growth is tax-free, and withdrawals for qualified medical expenses are tax-free. After age 65, you can withdraw HSA funds for any purpose without penalties, though you'll pay income tax on non-medical withdrawals. Here's a strategy most people miss. If you can afford to pay medical expenses out of pocket during your early retirement years, let your HSA continue growing. Keep all your medical receipts. You can reimburse yourself from your HSA years later, even decades later, as long as you have the documentation. This turns your HSA into a stealth retirement account. Strategy number 3, ACA Marketplace Optimization. The Affordable Care Act Marketplace can offer substantial savings, especially if you manage your income strategically. Premium tax credits are available for individuals with modified adjusted gross income between 100 and 400% of the federal poverty level. For 2024, that's roughly $15,060 to $6,240 for individuals. Here's where early retirement planning gets sophisticated. If you're living off investment accounts, you have significant control over your taxable income. By carefully managing withdrawals from traditional IRAs versus Roth IRAs and timing the sale of investments, you can potentially qualify for substantial premium subsidies. Some early retirees reduce their monthly premiums from $1,500 to $300 using this strategy. Strategy number 4, healthcare sharing ministries and short-term medical insurance. While not traditional insurance, healthcare sharing ministries can provide coverage at 30 to 50% less cost than conventional plans. These faith-based organizations pool member contributions to pay medical bills. However, understand the limitations. They're not regulated like traditional insurance and may not cover pre-existing conditions or certain types of medical care. Short-term medical insurance plans can bridge gaps between other coverage options. These plans typically offer lower premiums but higher deductibles and limited benefits. They're best used as temporary solutions rather than long-term strategies. Strategy number 5, geographic arbitrage for healthcare costs. Healthcare costs vary dramatically by location. The same medical procedure that costs $10,000 in New York might cost $4,000 in Texas. Some early retirees are strategically relocating to states with lower healthcare costs and more favorable insurance markets. Medical tourism is another option gaining popularity among early retires. Countries like Costa Rica, Mexico, and Thailand offer high-quality medical care at 60 to 80% lower costs than the United States. Many procedures that aren't covered by insurance domestically can be affordable options abroad. Now let's talk about the hidden costs that catch most early retirees off guard. Prescription medications can be devastatingly expensive without employer insurance. A single specialty medication can cost $3,000 to $5,000 monthly. Dental and vision care, often excluded from basic health plans, can add thousands in annual expenses. Emergency medical situations can quickly exhaust savings, with the average emergency room visit costing over $2,000. Here's a crucial planning consideration. Your healthcare costs in your early 60s will likely be significantly higher than in your mid-50s. Age-related health issues become more common, and insurance premiums increase substantially with age. A 60-year-old pays approximately 50% more for individual health insurance than a 55-year-old. Let me share a real-world example. Sarah retired at 56 with $800,000 in savings. She initially budgeted $12,000 annually for healthcare costs. By age 63, she was spending over $28,000 yearly on medical expenses due to a chronic condition and rising premiums. This unexpected increase forced her to consider returning to work for health benefits. Contrast this with Michael, who retired at 55 after maxing out his HSA for 10 years. His $75,000 HSA balance, combined with strategic income management to qualify for ACA subsidies, kept his healthcare costs manageable throughout his early retirement years. The key lesson here is that healthcare planning for early retirement requires the same level of attention as investment planning. You need multiple strategies working together to create a robust safety net. Here's your action plan. First, calculate your true healthcare costs for the past 3 years, including premiums, deductibles, copays, and out-of-pocket expenses. This gives you a realistic baseline for planning. Second, research health insurance options in your area at least 6 months before retiring. Marketplace plans, COBRA costs, and alternative options vary significantly by location. Third, maximize any HSA contributions while you're still employed. Fourth, consider how your retirement income strategy affects your eligibility for ACA premium subsidies. Fifth, build a dedicated healthcare emergency fund separate from your general retirement savings. Medical emergencies don't wait for convenient timing. The healthcare gap from 55 to 65 represents one of the biggest financial risks facing early retirees today. But with proper planning and the right strategies, you can navigate this challenge successfully while protecting both your health and your financial security. Remember, Medicare eligibility begins at 65, so your goal is to bridge this decade as cost-effectively as possible while maintaining quality coverage. The strategies we've discussed today can potentially save you $50,000 to $100,000 during this critical period. Healthcare costs will continue rising, and the rules around insurance and subsidies will continue evolving. That's why I'm constantly researching new strategies and sharing them with our senior smart money community. Make sure you're subscribed and hit the notification bell so you never miss an update that could save you thousands of dollars. In our next video, we'll dive deep into Medicare planning strategies that can save you even more money once you turn 65. You'll discover little-known Medicare supplement options and prescription drug strategies that most seniors never learn about. Trust me, you don't want to miss that one. What's your biggest concern about healthcare costs in early retirement? Share your thoughts in the comments below. Your question might become the topic of our next video. Thanks for watching Senior Smart Money, and I'll see you in the next video.